Hello everybody, my name is Rachel Rodriguez Cruz. Today is April 13th, 2023, and this is Module 3 presentation. This is the back of my car, and these are my pointers as guidance for this presentation. So the components of the integumentary system. The integumentary system is the skin and is composed by the epidermis, the dermis, and accessory structures, and those accessory structures are hair, follicles, nails, and exocrine glands. And finally, we also have the hypodermis of subcutaneous layer, which is the deepest layer of the integumentary system. Next, we have the description of the epidermis, the dermis, and the hypodermis, and I'm just gonna do it in that order. First, the epidermis is the most superficial layer of the skin and is composed of stratified squamous epithelium, and it has 5 layers. I like to use the mnemonic COME. Let's get sunburned to remember the 5 layers of this epidermis. And the first one is the stratum corneus, then we have the stratum lucidum, then we have the stratum granulosum, then we have the stratum spinosum, and lastly we have the stratum basale. I apologize if I mispronounced any of them. It's kind of hard for me, especially since I am from Cuba and I get a super thick accent when it comes to these long names of anatomy stuff. Second, we have the dermis, and then the dermis is immediately below the epidermis, and it consists of loose connective tissue above a dense network of connective tissue fibers. And the dermis is composed of 2 layers. One is a superficial papillary layer, and the second one is a deep reticular layer. And lastly, we have the hypodermis, and this is located below the dermis and is composed of loose connective tissue with many adipocytes, which helps like stabilize the skin. The last point here is the clinical application of this system in my future career. I would very much like, and it's my goal, to become a PA and specialize in rheumatology. I believe that the skin is super important part in almost every single diagnosis of conditions in the rheumatology specialty. An example of that is lupus, is psoriasis, is psoriatic arthritis conditions. And like, for me to do that properly, like examine, diagnose, and treat those conditions, I would have to have a vast range of knowledge about the integumentary system. I also would like to add that I believe that every single provider should have an excellent knowledge of every single system in order to treat correctly their patients. Thank you so much, and again, this is my little card, and have a wonderful day. Bye bye.